Good afternoon, everybody, and welcome to the live stream of our 2021 annual general meeting. Thank you very much for logging in and joining us. The papers for today's meeting you can find on the Trust website. We aim to finish today by around 2:30. You can ask questions during the AGM by clicking onto the Q&A tab below the video player. We'll try to answer as many questions as possible today, but all of the questions we get, we'll put responses on our website by the end of next week. We've had some questions already in advance, so thank you for those. And we'll answer the questions at the Q&A at the end of the meeting. This live stream is being recorded and it will be available to watch on our website. Due to social distancing, the whole board is in attendance virtually. We hope that by the time of the AGM in 22, we'll be back to holding meetings face to face again. So to get underway, first of all, we've received apologies from David Walker, from Lynette Wells and from Miranda Kavanagh. Agenda item 2 is to receive and approve the minutes of the meeting held on the 7th of July last year. And so those are received and approved. So I thought we should start by just taking a look at who the board are. And you'll see in front of you the list of board members for 2021. The reason for putting this up is that there's been some quite significant changes in the last 12 months or so. Last year we had Dr. Adrian Bull, Monica Green amongst the executives, and we just replaced Jonathan Reid and Catherine Ashton. Barry Neelan was also in place as Vice Chair and Non-Exec Director. So this year we now have Joe Chadwick-Bell, who of course was with us last year as the Deputy, now as Chief Exec, Tara Argent, and Damien Reid and Richard were in post, but just when we had our meeting last year. Amongst the execs, Steve O'Meara, our Chief People Officer, is the most recently appointed, and our most recently appointed Non-Exec Director is Amanda Federo. So that's the board. I'm also pleased to formally receive the annual report and accounts on behalf of the board. And at this point, I'm going to hand over to Joe, who's going to lead us through the look back on the year past. Joe.
Many thanks, and thank you. So I just wanted to really start by saying, so thank you for joining us for the AGM today, and I want to take the opportunity to talk through our year and in review, and towards the end of this, share with you our new trust strategy, which has just been approved at our trust board today. This is my first AGM as Chief Executive, and although I've been part of the board for almost 5 years now, I still remain immensely proud of the trust and the services we deliver, and absolutely delighted to be able to be a chief executive in my local community and for a trust where I've had a really long career over many years now. So I plan to cover some key areas. However, our story of our trust over the COVID year, as we would call it, is best told by our marvellous teams. And so we'll be showing a video shortly, which I would urge you to sort of sit back and listen. It's quite an emotive piece and one that I think we're very proud of. But if I can have the first slide, please. So just briefly, so as you will hopefully be aware or maybe familiar with, we deliver care to around 550 million people across East Sussex, as well as a number of visitors, and with staycations, actually those numbers are going up at the moment, which is great for our local community, but obviously puts some additional pressure on the services that we need to deliver. We provide a diverse range of services across our community and our acute trusts, And we work with our health and care partners to ensure we focus on health inequalities, best use of resources, and to support patients who on discharge may need a little bit of extra help, or either to go home or perhaps into another place for a longer period of time. So if I could have the next slide, please. Thank you. So I just wanted to start with our people. So firstly, I'd like to take the opportunity to thank every member of staff and all of our volunteers, because actually we've worked with so many people over the last few months and over the last 18 months in particular, and everybody has worked over and above, and it's been absolutely outstanding, and they will tell you, as I say, that story themselves. We've got around 7,500 staff. It goes down a little bit, it goes up depending on sort of time of year and where we are in recruitment. But actually, I think you can see we've got a really diverse range of staff. We cover 106 nationalities. Our local population represents about 6% of people from a Black, Asian or minority ethnic background. But our staff represent about 18%, which is great. And 75% of our staff are female. As part of our response to the pandemic and with so much support to the NHS, we were able to double our temporary workforce teams. They are our flexible workforce, many of which are our full-time staff who want to do some extra hours, but also people that are support in terms of peak periods of demand, or where we have planned annual leave, training and some other absences. So to have 6,000 people supporting our substantive staff is absolutely fantastic. But I'd also like to take an opportunity to thank the 38,000 or just over people who applied to work at ESHT. That is absolutely fantastic, and I think it shows a great support for the NHS, and hopefully something that we can reward people with by offering them posts with us, either now or into the future. That's 30% extra on last year, but I must also draw out that our human resources team have been fantastic in supporting both the flexible workforce, but also our substantive. They've worked absolutely tirelessly to be able to support that. You may be aware as well that if we could have the next slide, please. Thank you. You may also be aware that we undertake a staff survey each year. And the results are really important to us so that we can ensure we look after our workforce. And we know that a motivated workforce will impact positively on patient care. And so we want to absolutely prioritise the health and wellbeing of our workforce, as well as focusing on delivering patient care. So over 51% of our staff responded to the survey. It's confidential, it's undertaken by an independent source. But actually, the average for the sector was 46%. So actually, we've returned more surveys than many of our peers. We know this has been a really difficult year for staff, and we're pleased to see that our survey scores have remained similar to the year before. And compared to other trusts, we've done really well. And many of the examples of the questions, we've been rated in the top 20%. We've seen improvements on how our staff have rated our quality of care, equality and diversity, their relationships with their managers, and team working, and continually rating ESHT as a place to receive treatment. But there are still areas that we need to focus on. So our priorities for 21-22 will be to work on the success with on our successes with 3 priority areas. And that's to continue focusing on health and wellbeing and make sure that our teams are involved in decision making around services and how we deliver, how we run ourselves on a day-to-day basis. Bullying and harassment, we've made huge strides over the years, but it is clear that we still have a few pockets where we need to make some further improvements. And we will be taking a very clear line on poor behaviours because it doesn't fit with our values, either as an organisation, and if I speak for myself, my personal values, and I know that of my executive team and the wider board. And we really want to make sure that we value our staff and that they have a really good, they've got greater job satisfaction. So if we could move to the next slide, please. Thank you. So if I can just talk through our financial results, which more detail you can find in the full report. So we delivered a small surplus for the year of 0.3 million. This means that we've broken even for the second year in a row. What we have done is in the last year has seen a significant increase in funding into the organisation to support COVID. And we've gone from 468 to 530 million as an income and expenditure for the organisation. What it has meant is that as an organisation, we've been able to fund things that we've needed to make sure that we can retain safe services for our staff. So the additional income has helped to fund additional wards, extra staff in areas across our acute and community services, and increased infection control measures. But that's just tip of the iceberg. We invested significant amounts into capital during the year, spending around £37 million compared to the 27 before. And those investments were into our states works, and we'll talk a little bit more about that later, and some of our digital investment to be able to support a range of innovative ideas, but also to support the COVID response as well. So over 100 trusts received funding to resolve historic debts, and as part of this programme we received 234 million. And there is a but, unfortunately. So that doesn't mean that we don't have any ongoing financial challenges, because as we take each year, we need to balance the amount of money coming in with the amount of money going out. And so we will need to continue to focus on that balance on a monthly and an annual basis. And as such, we will need to focus, and we are indeed focusing on efficiencies and productivity. So if I can have the next slide, please. Thank you. So we sort of over the last year, so whilst we've had a challenging year for obvious reasons in terms of working in a pandemic, we have continued to innovate and improve. And there's just a few little things that we've covered off in this particular slide. But actually the teams in our video will talk through so many more things that they're best telling the story themselves. So we have refurbished 2 wards at Eastbourne, and that's opened up additional capacity. We've increased our community teams to support discharge. We finished the new main entrance for those of you that have been into Conquest, and I think you'll all see that that's both better for patients, our visitors and our staff alike we're operating in a really great environment. We've invested in digital solutions to help support continued outpatient activities. We've had our 2000th baby born at Eastbourne Midwifery Unit. There's been refurbishment of theatres at Conquest, which again, in fact, I was in there myself for a few hours the other day, and it's a really great environment, really light, bright and plenty of space, so it'll be part of an ongoing programme. For those of you that have, for probably unfortunate reasons, had the opportunity to visit the emergency department at Eastbourne, you will see that it's a much nicer environment, and we have expanded some of the capacity, and in fact we've got some further work at both Eastbourne and Hastings this year planned in to expand some capacity. Some really innovative work in terms of developing our workforce. So our first physiotherapist in the South East is qualified to take blood, and that just shows that we can diversify our workforce, and is a really great opportunity for those working within the profession. And we started work on the new nursery building at Conquest, and that's important because what it allows us to do is offer a really good environment to the children of our staff. And I really must have a shout out to both our nurseries over the last year, who have really supported patients and our staff being able to come into work and keep our services running. So if we can just move to the next slide, and I just want to introduce our video really. So what I wanted to do was to share our ESHT COVID story. And I can talk to that, but really I wanted to make sure that our teams were able to talk about their experiences, talk about the service changes that they've made, and to ensure that we can continue to deliver services whilst keeping our staff and patients as safe as possible. So I think I will ask for that to be played, and if you could listen, I'd be really grateful because it's quite an emotional story. So.
The last year has been a year like no other in the history of the NHS. At East Sussex Healthcare NHS Trust, we've met this challenge, adapted, learnt and fundamentally changed forever as we responded to this global pandemic. During this unprecedented period, our staff tell their story of working through this challenging period.
It was in late March 2020 when we received our first inpatient with COVID. Cases were starting to increase across the country, and on March the 23rd, 2020, the Prime Minister declared the first national lockdown.
There was fear of the unknown, but everybody pulled together to plan, create additional capacity, and redesign the way we worked to keep our patients and our staff safe.
We set up a clinical advisory group of senior clinicians who met 3 times a week, and everything we did was based on clinical evidence and on advice from NHS IE and specialist societies.
At the start of the pandemic, we set up an instant control centre staffed by senior managers and supported by admin and our emergency preparedness, resilience and response team. The main function was to act as the central point for information and communications coming in or out of the Trust from the likes of NHS England, Sussex Commissioners, the Ambulance Service, Public Health England and even mutual aid requests from neighbouring organisations. It was a challenge as information requests were relentless and national guidance was constantly changing. We were closely linked to the Trust Executive Incident Management Team so as to record and communicate decisions made. There were a number of services that worked in the background to support this function, such as the information services, procurement, estates and facilities, communications and bereavement services. One of my abiding memories would be after the 5 o'clock Prime Minister's daily briefings, where we would receive a barrage of questions from all manner of quarters.
In the early days of the pandemic, the availability of PPE was a big story in the national media. We were getting daily national push deliveries of PPE and straight away distributing them out to our staff in the hospitals and those working in the community to help keep them safe and our patients safe. It was tight on a couple of occasions, but we never ran out of PPE. In the end, we used almost 36 million items of PPE, masks, aprons, gowns and gloves. At one point in the summer, this storeroom I am in now was full to the rafters with PPE.
Discharge hubs were set up as part of our COVID response at ESHT. It's been a great opportunity to bring all of our multi-agency system colleagues together to support and lead on discharge processes. We've used the National COVID Response Guidance to form our discharge pathways, and we report our medically ready for discharge numbers every day at national level. It's been a positive experience for everyone involved, as we have created a central hub of expertise to support our patients' journey leaving hospital.
Last year, when the COVID outbreak started, we had to prepare very well for managing these patients. My role was to create a faculty and lead the training for the newly qualified doctors and the redeployed doctors from other specialties to medicine. We expanded this training to all the staff at ESHT and prepared them with PPE training and simulation-based scenarios for COVID. It took a long time, around 2-3 months, to train most of our staff, and by the time we were well prepared to manage COVID patients.
The first wave of COVID was nothing like anything the staff had seen before. Our staff stepped up, were adaptive and responsive to the immediate changes that were required to deliver safe care. As a trust, we continue to offer emergency access for surgery and continue to operate on cancer and urgent clinical patients. We ensured that our wards and clinical areas were COVID safe. Our ophthalmic services moved primarily to the Bexhill Hospital site to ensure patient safety and continuous service for these patients.
At the beginning of the pandemic, the outpatient haematology-oncology units, the infusion units and the aseptics division of pharmacy did something truly amazing. Over a 3-day period, we clinically decided to move all of our patients to Sussex Downs College to enable us to safely give them their treatments.
First wave of COVID in critical care, we were asked to escalate our bed capacity to something like 3 times our normal ventilator capacity. So that meant increasing equipment, increasing staff, increasing space we had available in critical care. And we were able to do that successfully on both sites in Eastbourne and Conquest, allowing us to safely manage a number of COVID patients. We had really good outcome figures and mortality figures from the first wave and the second wave, thanks to the sort of rapid response of the critical care team and the trust to COVID-19.
To keep our patients safe during the pandemic, we divided our emergency department into a green zone and a red zone.
Maternity services were quite impacted by both waves of the COVID-19 outbreak. We had to suspend our home birth and birthing centre birth services due to the lack of availability of the ambulance service. We did try to help with that by setting up home-from-home rooms on the Conquest site to try and provide those facilities, but it was very difficult for families who had planned a home or birthing centre birth. We also had to reduce the ability for supporters to come into the unit for appointments, scans and visiting on the wards. And we do understand that that was really difficult for families.
At the start of the pandemic, we were inundated with support from national and local businesses. We've ensured that all the donations received have been distributed to all our staff groups. We've also been supported by the Friends of our hospitals with public donations, which have ensured that we've been able to enhance wellbeing spaces and rest areas for our staff. We really want to thank everybody for supporting our staff at East Sussex Healthcare Trust.
Esh Digital have been extremely busy this year in supporting the pandemic. We've delivered the following: Attend Anywhere for video outpatient appointments, built remote radiology reporting system, issued over 400 laptops and 450 VPNs to support staff working remotely or shielding. We've supported the relocation of clinical departments and actioned thousands of changes to locations and clinics on our patient administration system. We've built and delivered carts on wheels to wards and ITU to improve the access to the clinical systems. We've introduced Teams for virtual meetings, pulled data from our clinical systems to support the operational response, e.g. for oxygen usage. We've supported wards to use Nerve Centre to track COVID-19 patients. We've dealt with an increase of traffic and calls to our switchboard by over 50%. We've built and delivered tablets donated by the local community so patients could keep in touch with their loved ones. With all of this, still delivering business as usual and a new system into our emergency department to replace the current paper systems.
So in early 2020, we in the outpatient team here at Esh had what was essentially a tsunami of health problems coming towards us. We all prepared together, but in March 2020, as we came back from the short Easter break, we came back to delivering a very different outpatient service than the one we had before. One of the main changes was we had to reduce the number of face-to-face appointments within our departments. We, contrary to popular belief, our outpatient departments did not close. We continued to deliver services, but we prioritised our 2-week waits and our very urgent patients to be seen face-to-face. We see, on average, 450,000 outpatient attendances every year, and a very large number of those attendances all had to be changed from face-to-face appointments to either a telephone clinic or a video consultation. It was an incredible undertaking, and we have constantly learnt through the last 18 months of how to deliver more virtual clinics in a much better way.
So last year when the pandemic started, that was a challenge because every cubicle, every patient had to be a deep clean because everyone was query COVID. So one 8-hour shift, I did 22 deep cleans. Finding a new way of working during COVID was hard as well with the PPE and everything.
Obviously, it can be difficult wearing the full PPE when we were in the height of the pandemic. However, we were fortunate that there was certainly no PPE problems locally for us. We always had the right equipment to hand. As time's gone on, it was amazing to see the team pull together and everyone work as closely and as tight-knitly as we could to make sure patients had the best outcomes.
I can't stress enough the amount of support that I've received from co-workers. We're all sticking together, we're all in it together, and you know, it's that level of support that really makes a difference, sort of working in A&E, especially during the pandemic.
As children's community nurses, we have faced many challenges during COVID. We have carried out visits and training in gardens and driveways, under gazebos in schools, in home porches, wherever the families have felt most comfortable to see us. We were often, during lockdown, the only face-to-face contact that they had with the outside world, which was a big responsibility, but one which we took very seriously.
So during the pandemic, our patients with cardiovascular risks, heart attacks and strokes were very reluctant to come to hospital. There was a lot of fear. This was a challenge, and we spent our time sending messages out to our patients, informing about the importance of coming in early with heart attacks and strokes and the difference that could make. Minutes saves lives and saves heart muscle. As part of that work, and we changed our stroke pathway, as many patients after the stroke had to return back to hospital for further testing. We inserted a ILR loop recorder that allowed us to monitor patients, which would negate the need for them to come back in for further monitoring. And this change in pathway has been nationally recognised and put on a NICE sharing website.
In each of the waves, over 400 staff were redeployed from their usual job to provide support in areas that needed it most.
I normally work in ophthalmology outpatients as a matron's assistant and was redeployed to ITU during the pandemic. I found the whole experience overwhelming but incredibly inspirational and emotional. The team in ITU were truly amazing, kind and compassionate to each other and their patients, heightened by the fact that loved ones were unable to visit. An experience I will never forget, which makes me proud to work for the NHS.
I'm a physiotherapist, normally working in MSK. For the first and second wave of COVID, I was redeployed to critical care, working with the respiratory team, which is an area that I'm neither that confident or well experienced in. Saying that, the team were amazing and we really came together, and I was provided a lot of training and a lot of support, and despite it being quite a terrifying time for everybody, I think we all came together really well and made a really good team.
In order to protect our staff, some had to self-isolate for long periods, while many others had to work from home.
During the pandemic, I had to shield due to health reasons. Being a matron who's very active on the ward, usually I found it quite challenging. Although I was working from home, I didn't feel that it was the same, and I did have quite a sense of guilt, especially in the second wave, when I knew the daily challenges that my colleagues were going through. Although they said they felt I was supporting them and I was in contact with them on a daily basis, I did still find it really hard.
Throughout the pandemic, we received support from all of our health and care partners in the Sussex system. But as we planned our recovery, it was blown off course by the start of the second wave.
I remember back in March 2020 having conversations with people about the virus, and some people not always taking it seriously and saying it's just like the flu or was just a fuss about nothing, and if only they'd known what was about to happen. While the first wave wasn't as severe as everyone had expected or planned for, the second wave had a massive effect on all of us. On December the 2nd, 2020, things just took off exponentially, and it wasn't a slow increase, it was sudden, huge, and almost like a tsunami. It was absolutely nothing like the first wave. In the peak during January, over half of all of our beds across the trust had people who'd tested positive, and at its peak was almost about 450 cases. Outside of the hospital, the numbers in the local population testing positive for the virus were huge. Most of our staff lived locally too, and they were also affected by that. We had huge numbers of staff affected and absent. December and January were incredibly difficult, and it's like nothing I've ever experienced during my 32 years in the health service.
The second wave of COVID saw a significant increase in COVID patients and also impacted on our own staff and their families. Although staffing at times was challenged, we ensured daily that all our areas were able to deliver patient care safely. We ensured our staff were supported and we were grateful for the many donations we've received. We continued to operate on all clinically urgent and cancer patients in a COVID-safe environment. Our colleagues at QVH took on the breast care service, which has now returned to the acute sites. Outpatient activity continued with either face-to-face or virtual clinics.
So during the second wave in January, we opened up Furward House. We opened up 10 beds with the local council. It was to help clear out the acute hospital to take patients who are waiting for COVID negative swabs, who are going to nursing homes or going home with packages of care. This was supported by the Frailty team, by the BADA, and by Women's Health, redeploying their staff to help support patients within this unit for the duration of January.
Since the beginning of COVID, a new test has been needed. Originally, that happened in a number of centres around the UK, our local centre being Southampton. That resulted in a number of delays in patient pathways. Across the last year and into December of last year, we created a new laboratory for COVID testing, allowing us to do over 500 COVID tests a day, all within 24 hours. This has helped us streamline patient pathways and improve the safety of our patients' care.
During the pandemic, we identified a need to improve our oxygen supply. So what we've done, evidenced by the Eastbourne plant at the back here, is put some new plant in, which has essentially doubled the capacity of oxygen available for our patients, also doubled the flow rate as well. And we've done that at both Eastbourne and Conquest hospitals.
We were better prepared during the second wave and had the space available and the equipment available and the know-how, but were exceedingly busy and had some of the the worst times on critical care during that period. And the staff really pulled together as a team and got through it, and again provided excellent care for the patients during that time.
I came out of retirement to help set up and run the post-COVID assessment service in February of this year. We're working in a very different way to how I was working in the Trust previously, because we're assessing patients virtually, most of them by telephone assessment, but we can also use video links, do see some people face to face. We're also running groups using a virtual Accurex space, and it's a huge privilege to come back into the Trust and work with patients again.
We are now in our recovery phase. We are supporting staff returning to their substantive posts and having engagement and debrief sessions. We're adapting to different ways of working on the back of COVID to ensure we provide a safe, efficient service. We are aiming to achieve 85% recovery by the end of July 2021, and will continue to return to pre-COVID levels going forward.
At the peak of the pandemic, we in surgery have had to follow national guidelines to prioritise patients needing emergency surgery or treatment for cancer. But thanks to following isolation guidelines and benefits of vaccinations, we are currently in a position to resume normal services. As expected, there is a massive backlog of patients waiting to be seen and operated on. All members of the surgical team are working extra hard to provide additional clinic capacity and operating lists to address this backlog. We are deeply appreciative of the patience and goodwill the local community have shown.
We saw an increase across the system in terms of children presenting with mental health and eating disorders. Also, we've been told to prepare for an increase in respiratory illnesses in children over the coming winter. And we're working with our colleagues in critical care and emergency departments to work a plan to make sure that the service is provided safely over that time. Since the end of the second wave, we have seen a significant increase in the number of attendants at our emergency departments. We have noticed a 20% increase in attendance. We advise patients to call 111 before attending the emergency departments.
I'm Uma Pradhan. I've been infected by COVID last year on the month of March. So that time I was very ill and I don't know anything, I'm unconscious. So I've been in ICU for 23 days. All the nurses and doctors are fantastic. They look after me, they care me, they give full effort to me. When I discharge, all the staffs just clapping me and welcoming me both sides of the corridor. So that gave me a lot of support to me. I'm very grateful to NHS. Thank you.
Tragically, 3 members of our staff caught COVID and died during the pandemic. Pooja Sharma, a pharmacist, Tony Morrison, who worked as part of our temporary workforce in human resources.
In January, the housekeeping department lost a much-loved supervisor to COVID. Losing Michael Winchester hit the colleagues across the hospital hard. He'd been at the Trust for 16 years and was a popular, well-respected and kind colleague. With COVID restrictions in place, it meant colleagues could not attend his funeral or come together for a memorial service. We miss you, Michael.
Pooja, Tony and Michael are greatly missed.
I think it's fair to say that COVID has tested all of us personally and professionally more than any of us could have imagined. In recognition of the emotional impact this has had on our staff, we've enhanced our range of support so staff can now access interventions that will help their psychological well-being and recovery. We completely understand that the demands on everyone continue, but we encourage all staff to prioritise their own well-being and take up these offers.
From late December to late April, we set up 2 fully functioning vaccination hubs from scratch, one at Eastbourne District General and one at the Conquest. In those vaccination hubs, we vaccinated around 25,000 of our staff and local health and care staff. That equates to 50,000 vaccinations. It was the privilege of my 36-year career to be part of that programme that gave so much hope to so many colleagues.
The vaccine presented us with a number of logistical challenges. It was provided frozen in packs of 1,000 and once thawed had to be used within a 5-day period and could not then be moved about. And the preparation of the vaccine was also complex and difficult because it's particularly fragile and easily damaged. So we had to maintain very careful monitoring by the pharmacy team within the vaccine hubs, and the team also provided technical and clinical advice to the vaccinators there. Altogether, it was an extraordinary team effort.
Working on the respiratory ward, we've been right in the eye of the storm this past year. I can honestly speak for my team and myself, it's been the hardest year we've ever endeavoured in nursing. I have to say that I couldn't have been any prouder of my team.
During the pandemic, visiting was restricted, and to help entertain patients, Sam and Hannah and people like them came to entertain the patients by playing music outside.
Thank you for being there for us. Oh, the NHS, this is for the NHS.
It was also the duration that made it so difficult. It wasn't just days or weeks, it was prolonged and it had a significant impact. Staff have been tearful. I've been tearful and I've cried with staff. And they weren't crying for themselves, but for the impact that it's had. It's been very distressing and very exhausting. And we've all been exhausted from it, everybody. But it's not just physical, there's also very much about the emotional impact. But we are now looking to the future and we're being positive. And we don't want to forget, as much as many of us would like to, about what has happened over the past year. We must acknowledge the difficulties, but move forward. One of the really difficult things all along has been restricting visitors, and that's been very difficult and distressing for staff as well as loved ones. I'm hugely proud of all of our staff, and not just the doctors and the nurses and the support staff, but the hundreds of staff that were redeployed. I'm enormously proud of each and every one of them and the strength that they've shown. The camaraderie has been amazing. It really is quite extraordinary.
It's been a year none of us will forget, a year that was
life-changing,
exhausting,
draining,
overwhelming,
heartbreaking,
frightening, emotional,
challenging,
relentless,
unbelievable,
stressful,
but with
teamworking,
caring, camaraderie,
rewarding,
and hope with the vaccine rollout.
It's been an extraordinary year that we've just been through, and I wanted to say on behalf of everybody on the board a big thank you to all of the staff for the amazing work that you've done during the course of the last 12 months. As a patient, I also wanted to say thank you on behalf of the thousands of people that have been treated at the Trust in the course of the last 12 months for all the care and attention that you've given to us. It's been amazing. I think the work that's gone on in the Trust has been absolutely heroic, and I wanted to thank you all for everything that you've done.
I just want to say that I'm so immensely proud of our teams, and I've really seen the best of people in the worst of teams. I found this really quite emotional, and I've seen it a couple of times, and really inspiring. So thank you. If we could have our next slide, please. So I just wanted to a few more thank yous before we sort of move forwards, really. So in terms of our community, so we received amazing support from the Friends of our Hospitals, and they have continued to purchase equipment despite the challenges of fundraising, which is particularly challenging during a pandemic. Our local communities also supported us with donations to support our staff wellbeing. We also know that many people donated to NHS charities, and I know you'll be pleased to know that we have received around £350,000 to support our staff. And so thank you. It really has been appreciated and at this time for us. So if I could have the next slide, thank you. So we need to move on really, and we are going to need to live with COVID, and we'll need to develop our services as we go forward to make sure that we can live with a level of COVID as kind of part of our daily living really, and how we provide our services. So I just wanted to share with you our priorities for this year, and then I want to take you forwards in terms of looking beyond today and over the next 5 years or so. So we have got a few specific priorities for this year, and I just wanted to sort of take you through those. And there are 6 really, and they look fairly simple, but actually there's a lot of competing priorities within this. So firstly is continuing to support the health and wellbeing of staff and taking action on recruitment and retention. The recovery of services and building on the lessons learned during the pandemic with a really great focus on transformation. We've learned huge amounts about ourselves, about the organisation, how systems can work together. And so we want to see things transform, take that innovation and really focus on doing that at pace, as we have proved to ourselves over the last year and a half. We still want to make sure we focus on our key access standards, so particularly our emergency department and our cancer services. We still need to deliver our financial position and drive through efficiencies to do that. As the NHS changes, we want to make sure we play a proactive role in the integrated care system, which is the Sussex Health and Care System, and what we would say place, which is around the East Sussex more specifically, and focusing on local health outcomes and addressing inequalities, as well as delivering our core services. Of course, we need to do that within the context of maintaining a high standard of care and continuing to meet the needs of our patients with COVID. So they are our priorities for this year, whilst we continue to look forward and develop our strategy. So with that, if we could have the next slide, I really wanted to just talk to you about moving forwards really. And just before I do, I just want to do a very quick touch on where we've come from and then how we plan to move forwards. So we've been working on the Trust strategy actually over the last year really, recognising that we had a pandemic which took us a little off course. And the focus really is on the next 5 years and beyond. But just to start, if we just take you back, so many of you remember that 3 years ago, the Trust was in a really very different position and with different challenges than those that we see today. But we've worked really hard together, and in 2018, we exited special measures for quality, and in 2019, we did the same for finance. Our strategy during that time was largely internally focused, with the aim of moving towards an outstanding CQC rating, and we did that in many of our services and getting ourselves into a better financial position. And you'll know that although we have a good rating overall, there are many services, and particularly for caring, that are CQC rated outstanding. So we've done really incredibly well, but we now need to look forward. So if we could just have the next slide, thank you. So if I can just talk through our current challenges really, and I think we've shared some of those, although the look back over the last year, 18 months, they still stay with us. But you will be aware, I'm sure, from local news, national news, NHS structures are currently in transition. And as part of that, there is a much greater duty to collaborate with the NHS or between the NHS and local authority partners in order to maximise use of resources, improve pathways across providers, and focus on population health and inequalities while still delivering our core services. Whilst there are investments into the NHS, the specialist workforce in some specialties continues to be a challenge, and as such we must maximise those skills through our service design. We know that East Sussex has a diverse range of residents and local communities, some quite affluent, but others where there are extreme pockets of poverty, and we recognise the poor links out of the county. We have an ageing population which brings increases in demand and higher dependencies on some services, and actually for us particularly into our community services as well. There's the next slide. So how are we going to take the organisation forward? What's our response to that? So we've developed 4 strategic aims. The first being improving the health in our communities. So that reflects our diverse population, recognises that COVID will have a long-term health issue for some people, and again recognising an ageing and more dependent population. Our second is collaborating to deliver better care. So working with health and care partners to improve access to services and streamline patient journeys across primary, acute, community and other health and care services, and increasingly involving local councils and voluntary sector partners. And we want to make sure that we can continue to deliver a wide range of services within East Sussex. We want to make sure as a core pillar that we empower our people. Staff remain our greatest asset. We want to engage our staff in how to deliver better services. And over 80% of our staff will live within 10 miles of one of our hospitals. And so it's where they receive their care, their friends and their family receive their care. And so actually our staff are invested not just in delivering the day-to-day services and the excellence in care they provide, but they're invested as members of the local population, and of course are interested in how we will continue to deliver services should or when they need that, and hopefully in years to come. And then lastly, but equally importantly, is ensuring innovation and sustainable care. So we're already recognised as driving digital innovation across Sussex, but there's still a way to go. And as part of our Building Our Future transformation programme, we aim to modernise our facilities and maximise the use of digital and the buildings from where we deliver care. Recognising, of course, that we need to ensure that solutions remain accessible for all of our patients, recognising the diverse population that I've just been talking about. But in order for services to become or remain sustainable, they must deliver safe and effective care, have a reliable workforce in terms of staffing numbers and skill mix, and it must be financially sustainable. So if we could just move on to the next slide, please. So we have developed a set of priorities that we will report over time how we're doing. And those are written on the slides that you can see there, but I will just read through so they're easy to see. So just turning a page so I can see them clearer as well. So under improving the health of our communities, we want to make sure we're developing excellent care for our older people, supporting digital by default across all of our services, and tackling persistent health inequalities across Sussex and quite specifically for us, East Sussex.
Under collaborating to deliver better care, our priorities are driving collaborative change to acute provision to improve access for patients, supporting the development of primary and community pathways within East Sussex and across Sussex where that's appropriate to do so, and continuing to strengthen joint provision with East Sussex County Council across integrated care projects to deliver better care. Within empowering people, we want to create a supportive, rewarding workplace for our people, building on the foundations of a just culture model to enable all staff to feel that they have a voice, strengthening our model of improvement to underpin a learning culture, and implementing digitally enabled flexible workforce. And then in terms of ensuring innovative and sustainable care, it's ensuring financial viability, not just for us as an organisation, but with our commissioners and as a system, health and care system across Sussex. Delivering high quality, flexible and future-proofed buildings, supporting productivity-focused transformation, and ensuring clinically led innovation underpins all of our planning. If I could just have the next slide as well, thank you. So what does ESH look like in 2026? Well, I think the first thing to say is that we're sharing our overarching strategy, and this will be underpinned by the supporting strategies, which will give more of the specifics. So in the new year, we'll be able to share our clinical strategy, our people strategy, our digital and our estate strategy. And there's a lot of work going into that now, and engaging with all our clinical teams and our operational teams to make sure that we are able to describe how we get to reach our overarching strategy over the next 5 years and beyond. So in 2026, we, apologies, I'll just pick the next slides up. So in 2026, we aim to have excellent, high quality care for patients with national recognition for at least one service area. And that will be around frailty, but will be other key areas as well. We would want to be recognised as a great place to be for the quality of care we provide and the support we offer for our people. Prioritising our approach to green and sustainability issues, notably our footprint through our Building for Our Future, our transformation programme and hospital development programme. New clinical roles and ways of working that are collaborative and innovative and that reach across our organisational boundaries. A digital way of working across our services leading on Sussex-wide programmes of work, and make sure that we're a financially sustainable organisation with a viable Sussex, within a viable Sussex region. So we will have our full document available on our website, and we'll have a communications and engagement, particularly from an internal perspective, with all of our staff. We have undertaken quite a considerable amount of engagement to get to this stage, and we've shared this with our local commissioners as well. So I'd just like you to say thank you, and I believe we've had a few questions come in that we might want to answer as well. So I'll hand back to Steve. Thank you.
Thanks, and thanks for giving us that detailed look back at the most extraordinary year I can think of in my 42 years in healthcare, and a glimpse forward as to what the future might look like. And some of the questions that we've got relate to the future. So the first is a group of questions that have been posed about cardiology and urology in Hastings. The question is about the plans for those services in relation to Hastings. Are the changes that have been implemented temporary? When will they return to normal? So let's start with that.
Thank you. I'm just going to take those as slightly separate because the answers are slightly separate depending on. So in terms of urology, urology is based at Eastbourne. We provide tertiary cancer services for urology patients, and both emergency and planned elective services. That service is, we are planning for that to remain at Eastbourne, and although patients with urology, if they with urological needs, if they do come to A&E at Conquest, will be seen and treated where possible. Should patients need the specialist care, then they would be transferred across to Eastbourne. So no change there, and we're not planning on changing that. In terms of cardiology, we deliver cardiology on both sites. We have had to make some interim changes during the last 18 months based on some equipment challenges, but also staffing challenges, which almost all services have been affected by. So we are currently looking at our cardiology services and what that might look like going into the future. We're just working on a business case at the moment, and we have been engaging people in what they would like to see in future services, but also what they think of our current services. And we're just working through that at the moment. Should we choose, should the result, sorry, apologies. So we're currently working with a CCG on that. Should we want to get to the final stage of that, which is to go out and further engage our public, if this constitutes, or the plan changes constitutes a major service change, then we would go out to public consultation before any changes are made. That would go to the Health and Overview Scrutiny Committee to determine whether public consultation is required, and that won't go before December. And so any consultation we start would not be before January next year. But should we decide that that's where we want to go, then we will absolutely undertake a formal public consultation. In terms, and I think really that sort of covers the urology and cardiology element.
Yeah. Thanks, Jo. We've got a question about the Building for the Future plans, and have been asked whether any plans have been made to expand the services currently offered at Eastbourne DGH as part of the new hospital programme that we're involved in. And the second question, related question, what would make you decide to bring back core services to the hospital? And I wonder if I might start with some personal thoughts on the second of those. We don't have a formal board view of it, but to my mind, it would mean, first of all, safety would need to be improved, and quality would need to be improved, and workforce challenges would need to be eliminated, and that's things like recruitment, retention, education, training, deployment, and there would have to be clinical confidence in the model of care, and there would need to be clinical support to the change, and professional standards would need to be met, and caseload issues would need to be addressed, and finally financial efficiency and productivity improvements would need to be delivered. So I think there's an important set of interconnections that I would think that at the board that we would be looking at with any plans. But those are just sort of personal thoughts from me, Jo.
Thank you. So I won't repeat what you've said, because my list is pretty similar, but I might reiterate a couple of points. So just to go back to the first question, with the exception of ophthalmology and cardiology, which I'll come back to, although I've already touched on cardiology, we're not anticipating any major service reconfiguration. As I mentioned earlier, we are developing our clinical strategy, but within that, we're not anticipating any major service change. And so the current configuration of trauma being at Conquest, so it's the trauma units, most of the orthopaedic work, and our paediatric inpatients and emergency services, and our emergency surgical services. And then we have stroke at Eastbourne and urology at Eastbourne and ENT at Eastbourne. And so we don't anticipate any changes to that service configuration. The exception is cardiology that I've already touched on, where we're looking at what we would like, or we believe it would be the right model to go forwards. And we're also looking at ophthalmology to see if we are delivering the most optimal care, and particularly in a COVID world where we want to make sure that we've got COVID secure facilities to maximise that care to patients and optimise the resources and skills that we have got available to us. So as with cardiology, should there be any major change or consideration of major change for ophthalmology, then again, that would go to a health and overview scrutiny committee, and potentially, depending on the scale of that, that will be subject to public consultation. But in summary, no plans to change the core configuration of our services at the moment. In terms of sort of the question around what would it take, I think, Steve, you've answered that, so I won't add any more, because I think exactly the same as you, same list.
Okay, thanks, Jo. There's a very practical question that I'm not sure, I don't know whether we have the information immediately to hand. Please, can you provide timings of the journey between Eastbourne DGH and the Conquest by different modes of public transport used? That might not be information you have immediately to hand, Jo, or you might.
Or I might. So it's around 20 miles between the two sites. The technical answer is it's 35-minute travel time. I think that very much depends on the day of the week and time of the day. So we recognise that at sometimes that can be a little longer, but actually it can be a little bit shorter as well. But they're, of course, normal road times, which is not quite the same as if you were travelling in an ambulance on blue lights. Again, that can vary as well, but out of hours that would definitely be quicker, and probably about 35 minutes during daytime.
Thank you. To continue with some of the other questions that we've had in, will virtual outpatient appointments continue after the pandemic?
Yes, is the short answer to that. So there's a number of things that we're trying to do to transform our outpatient services. Not every patient, so what we need to make sure is that we want to offer a virtual appointment where it's appropriate, based on those patients' needs, but also based on their clinical requirements. And many outpatient appointments can be done on a virtual basis. It saves people having to travel in, to park, and it's much easier in many cases to do that from home. But we recognise that doesn't work for everybody. So we either offer we will offer face-to-face where patients need to come in to be seen. You appreciate there are some conversations that need to be done on a face-to-face basis, and those will continue. So we're trying to get the balance of that, but absolutely, and particularly for our follow-ups, we will continue to do that. We'll also see increasingly that something called patient-initiated follow-ups as well. So for those that have got long-term needs, appreciate that perhaps not every time they come in for an appointment that we may be adding value, or they may be repeating information. And so what we want to put for some conditions, for some patients and some specialties, that we've got the ability for patients to self-determine or self-direct whether they need to come in and have a hospital appointment. And so we're working with clinical teams to be able to do that. And actually on top of that, advice and guidance. So we're offering service to local GPs where perhaps they may not feel that their patients need a full outpatient appointment, but they do want access to specialist advice. And so they will be able to do that, which will negate the need for outpatient appointments, but still with that specialist advice. So it's a whole range of things, which is a long answer to a short question.
And actually, in lots of ways, I mean, as somebody who's been a patient himself in the last 15 or 16 months, having a different array of contact with health professionals to get advice is actually what you need, rather than a long drive into the hospital and a wait in an outpatient room, etc., etc. So good stuff. Somebody's written, I've been waiting for surgery after my original date was postponed due to the pandemic. How long are waiting lists, and what is the trust doing to address this?
So waiting times absolutely vary by specialty and depending on clinical priority. We have some very specific targets and areas of focus in terms of long waiting times or maximum waiting times. Our aim is, and what we're working to, is to make sure that we don't have any patients waiting over 52 weeks. We've currently got about 70, and that is not a number that we feel comfortable with. And certainly in the past, we have not had, for many years, any patients waiting over 52 weeks. That said, we have a very few number compared to other organisations and some of the wider NHS. So actually the teams have done remarkably well to do that. We don't have any patients waiting over 78 weeks, which is the next step. So we've got around 70 patients, and more than half of those have got a date to come in. What in terms we do is to make sure we manage both our clinical risk as well as the experience of patients. We do prioritise every patient on our waiting list waiting for surgery, actually, and outpatients now, and diagnostics. And so our aim is to focus on the most clinically urgent patients, particularly on what we would call P2s. So they're the patients that need treatment within 5 weeks. But we're also continuing to focus on our long waits at the same time. We've talked about outpatients, so that helps maximise the resources that we've got available. And then we're really focusing on a whole range of activities, really. We've brought in some additional capacity for some of our diagnostics. We are focusing on day surgery as where that's appropriate for patients. We are doing some waiting list initiatives, but we also need to recognise that our staff need a bit of a break as well because they've worked incredibly hard. So I think we're doing really well. Our overarching aim is to make sure that we've got the same activity levels as we had 2 years ago, and we are achieving that with a few challenges for patients who need overnight stays, but we are achieving that. So it's a range of things, and for sort of a more full answer to that, if you look back at our board meeting that we've just had, some of that's covered off in our board papers today that will be available or are available on the public website.
Thanks, Jo. That's very helpful. There's a question, what are the plans for ophthalmology services in Bexhill?
So I think probably I touched on a little bit at the moment. So we currently deliver services across 3 sites, and we're considering really whether that is the most optimum use of our resources, and whether we could potentially consolidate services onto whether we still need to deliver services across those 3 sites. So we're in the process of that at the moment. No decisions have been made. And we are just looking at model of care, and we will take that through any formal process if that's where we decide that we want to go.
Thank you. And then a couple of questions that might be difficult to answer with any precision that are related to visiting. So I'll take the 2 together. The first is, when will staff and visitors be able to stop wearing masks in the hospital, and when will visiting return to normal in the trust? Are the two questions. Difficult to answer, but give it a go. Give it a go.
I'll give it a go. So the simple answer is I don't know, but just to give you sort of perhaps management expectations, really. So in terms of wearing masks, there is very clear guidance from a national guidance that both staff and patients need to continue to wear masks, and visitors need to continue to wear masks if you're attending a healthcare setting. It's really important. We still have COVID patients in the community. We've still got COVID inpatients. And so to be able to protect yourselves, protect our staff, and protect our patients as well, we are very clearly asking people to continue to wear masks as they come into hospital. In terms of when that stops, if I'm honest, I probably don't anticipate any change in the near future, and it wouldn't surprise me if we didn't keep that in place now until we get past the winter. I know that's quite a long time, but we are likely to see some surge, and same with flu, really, that we are expecting this winter as well. In terms of visiting, I think it's the same answer to some extent. The reason we've got restricted visiting, and I recognise that it's really difficult for patients and it's really difficult for loved ones, friends and family, and actually in turn it becomes more difficult for our staff as well. But we do need to maintain some social distancing. And we do need to make sure, again, because we do have relatives, there is the potential, and we have had in the past, where relatives or friends and family have come in and passed the evidence is that we have people had their loved ones actually contract viruses from those visits. So it's absolutely vital that we keep some restrictions in place. And again, I would anticipate that that's likely to be in place until after the end of the winter. So probably not everyone wants to hear, but I think it's the reality to keep our patients, visitors and our staff safe.
I think that is the reality, isn't it, given everything that we know. A question about car parking, always a hot issue for us. Somebody's written, I've seen that planning permission has been granted for a multi-storey car park at Conquest. When is this going to be built?
So we have got some resources available to do that for this year. That's come through as part of our hospital development programme, and we are anticipating that starting this calendar year, this financial year, with the majority of the build being into next year. And so that's the precursor for any development works that would be happening in due course.
I think extra car parking space is always welcome, aren't they? Joe, that's the end of the questions that have made their way through to me. If there are any that have not yet got as far as me, we'll respond to those, as I said at the beginning. Excuse me, by putting the answers on the website before the end of next week. But with that question, that brings the AGM for 2021 to a close.